My name is Alex. I'm one of the registered nurses here, and today we're going to be doing the sublative on my good friend Rainey here. Rainey had a sublative about 3 months ago. However, she really loved how it turned out, so we're going to do the same thing again. The sublative is really to help tighten the skin, fix some textural issues in the skin as well. It does nothing for pigment, nothing for vascularity, but it really helps tighten the skin and build that collagen because of the amount of heat it produces. Since it can get a little bit hot, we went ahead and gave her the Zimmer. It blows cold air, just so that she also feels more comfortable. Right now she's blowing away from her because it is turning into Alaska. So if you have any questions, just go ahead and put them in the comments and we'll answer them later. For the live, if you have any questions, go ahead and ask them and we'll answer them while we're doing the laser. We're gonna do the first test spot right here in the center of the forehead. 1, 2, 3. How'd that feel? Perfect. It didn't feel too bad. It's really not that bad. After we continue on, it might feel a little bit too hot. She'll let me know and then we can knock it down a little bit just for patient comfort. She's not wearing any shields because it is radio frequency, so it's not light. If she wants to close her eyes, she can just for comfort. If she wants to keep them open, that's entirely up to her. So let's get started. How are you doing so far?
Fine.
Good. You don't want the Zimmer?
Not yet. That's when I get panicky.
Rainey has one of the craziest reactions to the sublative. Rainey blows up like a balloon, which is totally possible with the sublative.
It's worth it though.
It is worth it. She does swell a lot. She's going to be swollen for about 7 days. But the result is so beautiful. Little sensitive. 1, 2, 3. 1, 2, 3. 1, 2, 3. Rainey also has a super small face, so we're gonna be done in no time. Now, I did half her face right now, just about half, so you can see the contrast. You'll see she's super red here and she's still her normal skin color on this side. She'll probably start swelling up by the end of the live, even though it isn't that long at all in between. Rainey and I are also wearing matching socks, so if you guys are curious.
Fun fact.
Fun fact, today Bill went and recorded the socks. What did you feel like the sublative changed the most for you when you first had it done?
My jowls.
For anyone that doesn't know, jowls are right here in this area. Rainey claims to have bad jowls. If you look at her right now, you're going to be like, this girl has no idea what she's talking about. But it pulled it back, I guess, because she looks amazing right now. Rainey's still a little bit greasy on some areas, so from the lidocaine, we're just gonna clean that up just a bit.
We have a comment from Kat, the dog trainer. She's asking, what is this process called?
This is called the sublative. A sublative is a radio frequency device. It's not like a regular laser because what a regular laser does is it emit light into energy. This radio frequency uses that type of method to deliver that energy into the skin to really break down the tissue in the skin to be able to cause it to heat up to such a hot level to stimulate collagen. How are you feeling, Rainy?
Fine.
Not too bad?
No.
Sensitive, 1, 2, 3. 1, 2, 3. Rainy is a trooper because I would be crying at this setting. But I also have really sensitive skin,
So
so.
do I. This is like one of the least painful things.
One of the least painful? Good, I wanted to clarify that for the video, guys. I love my life. Does the forehead hurt more for you?
No.
The forehead kills me. If you guys were here in this room right now, you'd be smelling some chicharrones because you smell the skin burning. So I know it's an exquisite smell, but you know, it's what you have to do when you get a laser. And luckily for me, Rainy is pointing that air blower right at me, so I get every single bit of that smell. Looking good, Rainy. We're almost done. One, two, three.
Evelyn is saying that she sees some tears.
Is that true?
No. Evelyn's a monster.
Oh, Kat the dog trainer also has she has one more question.
Yes.
She said, can you please list all of the benefits of the Sublative?
Sure. Do you guys remember that video where it's just like beans, greens, potatoes, tomatoes? So it's just like texture, acne scars, wrinkles, jowls, fine lines and wrinkles, pore size. It's really good for pore size. It can actually decrease your pore size temporarily because it can be permanent. With that temporary pore size, as long as you keep doing the laser, you know, they continue to stay small, but after a while, it's not going to stay small anymore if you discontinue. But yeah, those are all the reasons. Like I said, it does nothing for pigment and it does nothing for vascularity. So it won't treat red, it won't treat telangiectasia, spider veins, things like that. It won't do it. Sensitive, 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Sometimes you have to wipe off the laser. There we go. Yep. The nose is always a sensitive spot, no matter how long you numb, no matter how strong of a person you are to pain. It's just brutal.
Done.
Almost. Your forehead looks so amazing. I wonder who did your disc sport. It was me, guys. It was me. I did it. Tuck in your lips, though. I'm gonna do the top of your lips real quick. This also hurts.
I don't want to do it.
I know. Ready? 1, 2, 3. 1, 2, 3. It's gonna prevent those lines from the top for me. And we are done. So now that I finished the laser, what I'm gonna do to follow up is I'm gonna get some Ciclofate and some Aquaphor. I'm gonna mix it together. I'm gonna put it on the face. She's gonna keep her face moist for the next 7 days. She's also going to protect it from the sun, so she'll be wearing SPF 30 or more. She'll be keeping it greasy with the Aquaphor. She'll be out of the sun by wearing sunscreen also as well. And she won't pick at the skin. The skin will slough off. It's going to develop this black coffee ground texture all over the skin. They're kind of like scabs. Those will come off on their own by day 5, 6, and 7. And then afterwards, she'll have beautiful skin. She's going to swell. Unfortunately, we just know how she reacts. So what she can do is she can put some ice every hour for the first 24 hours for 10 minutes. After the ice, starting tomorrow after 24 hours, she can use the heat compress. She knows she's been through this already before, just to inform you guys. But the main thing is to really keep the skin greasy. She's gonna have to keep it greasy with some Aquaphor to allow that skin barrier to heal over again. But we'll catch you next Wednesday, guys, for Zappy Hour. Thank you. Bye-bye.